Welcome to my channel Medicine Guide. In the last video we have discussed Flurbiprofen tablet, powerful pain arthritis relief. In this video we will discuss what to avoid when taking Flurbiprofen. That is its warnings. So let's start, but before that please subscribe to my channel Medicine Guide. Now let's start with warnings. Flurbiprofen can increase your risk of fatal heart attack or stroke. Do not use Flurbiprofen just before or after heart bypass surgery, coronary artery bypass graft, or CABG. Flurbiprofen may also cause stomach or intestinal bleeding, which can be fatal. Before taking this medicine, Flurbiprofen can increase your risk of fatal heart attack or stroke, even if you don't have any risk factors. Do not use this medicine just before or after heart bypass surgery, coronary artery bypass graft, or CABG. Flurbiprofen may also cause stomach or intestinal bleeding, which can be fatal. These conditions can occur without warning while you are using Flurbiprofen. Especially in older adults, you should not use Flurbiprofen if you are allergic to it, or if you have ever had an asthma attack or severe allergic reaction after taking aspirin or an NSAID. Tell your doctor if you have ever had heart disease, high blood pressure, high cholesterol, diabetes, or if you smoke, a heart attack, stroke, or blood clot, stomach ulcers or bleeding, asthma, liver or kidney disease, or fluid retention. Do not use Flurbiprofen during pregnancy unless your doctor tells you to. Using an NSAID in the last 20 weeks can harm the unborn baby or cause pregnancy complications. Tell your doctor if you are breastfeeding. Not approved for use by anyone younger than 18 years old. What other drugs will affect Flurbiprofen? Ask your doctor before using Flurbiprofen if you take an antidepressant. Taking certain antidepressants with an NSAID may cause you to bruise or bleed easily. Ask a doctor or pharmacist. Before using Flurbiprofen with any other medications, especially lithium, major interaction, nonsteroidal anti-inflammatory drugs such as Flurbiprofen may significantly increase the blood levels of lithium in some patients and cause lithium intoxication, which is potentially life-threatening and may require hospitalization. You may be particularly susceptible if you are elderly or have other risk factors such as kidney impairment, congestive heart failure, sodium restriction, and dehydration. Talk to your doctor if you have any questions or concerns. Your doctor may be able to prescribe alternatives that do not interact, or you may need a dose adjustment or more frequent monitoring to safely use both medications. Methotrexate, major interaction. Flurbiprofen may increase the blood levels and side effects of methotrexate. You may be more likely to experience this interaction if you have kidney disease or are receiving a high dose of methotrexate. The risk may be less if you are using methotrexate once a week to treat certain forms of arthritis. Depending on your situation, you may need a dose adjustment or more frequent monitoring by your doctor to safely use both medications. A blood thinner, warfarin, Coumadin, Jantoven, major interaction. Using warfarin together with Flurbiprofen may increase the risk of serious bleeding complications, especially in the gastrointestinal tract. Talk to your doctor if you have any questions or concerns. Your doctor may be able to prescribe alternatives that do not interact, or you may need a dose adjustment or more frequent monitoring of your INR to safely use both medications, heart or blood pressure medication, including a diuretic or water pill, for example, chlorthalidone. Moderate interaction. If you use chlorthalidone for the treatment of high blood pressure, talk to your doctor before using it together with Flurbiprofen. Combining these medications may reduce the effects of chlorthalidone in lowering your blood pressure, especially if you use Flurbiprofen frequently or regularly. For example, To treat arthritis or chronic pain, you may need a dose adjustment or more frequent monitoring of your blood pressure and kidney function to safely use both medications. You should avoid being dehydrated while using these medications to minimize risk of kidney problems. Steroid medicine, such as prednisone, moderate interaction. Using prednisone together with flurbiprofen may increase the risk of side effects in the gastrointestinal tract such as inflammation, bleeding, ulceration, and rarely, perforation. Gastrointestinal perforation is a potentially fatal condition and medical emergency where a hole forms all the way through the stomach or intestine. You should take these medications with food to lessen the risk. Talk to your doctor if you have any questions or concerns. Your doctor may be able to prescribe alternatives that do not interact, or you may need a dose adjustment or more frequent monitoring to safely use both medications. Your doctor may also be able to recommend medications to help protect the stomach and intestine if you are at high risk for developing serious gastrointestinal complications. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guy.